procedures available today have some pros and some cons associated with them. The lap band procedure has emerged as one that has the least invasiveness. So it is a truly outpatient procedure, one in which a person comes in to a surgery center or a hospital and undergoes an approximately 30-minute procedure and is home the very same day. There's no invasive incisions, there's no cutting and reconnecting of the stomach and intestines. And so for those reasons, the lap band offers a lot of advantages over the more invasive procedures. It is a procedure that allows for adjustment over one's lifetime. The band itself can be tightened or loosened by the adjustments done by accessing the abdominal port. So this adjustability feature is one that many people like and find helpful as they move through life's ups and downs over the years. It's also reversible, so this is a comforting thought, I think, for many people, perhaps young people who don't know what the future may hold 10 or 20 years from now, and undergoing an irreversible procedure may not be the right thing to do. The other very positive features of the lap band are that it has very compelling data over 20 to 22 years now with the lap band. In Europe, in the United States, in Australia, and South America predominantly, we see excellent results with long-term studies. It does require ongoing efforts and ongoing visits with the surgeon's office and ongoing adjustments of the band in order to really optimize that success. But I have many people in my practice who have undergone the lap band procedure, and many personal friends who have undergone the lap band procedure who've done very well with it. And it is a very effective tool that people can use to lose weight and keep it off. If there are downsides to the lap band, if there are disadvantages, I would say that in our practice we have found that it is not as hard-hitting a procedure that is likely to produce the dramatic weight loss as rapidly, for example in the first 6 or 12 months. When one compares the lap band to the sleeve procedure or the gastric bypass, we see that the weight loss tends to be slower, tends to take a slower, more sustained, steadier effort in order to achieve that same result. But many studies now that look at long-term results in practices that do regular follow-ups and band adjustments find that the weight loss results are very similar at 3, 4, and 5 years of outcome. Whereas in year 1 or year 2, the lap band does not look like it's going to be as effective. But as the years go on, it does seem to be roughly the same as the more invasive procedures in those studies. Other studies would still put it a little bit behind the more invasive procedures in terms of its long-term effectiveness or the long-term bang for the buck on the pounds lost. So these are qualities that one has to carefully consider with respect to the lap band before making that decision. But it is a very effective tool, and it's one that is, I think, going to be around for a long time in our arsenal as we fight this battle against excess weight gain and obesity.